Welcome back. The province of the Western Cape has passed the peak of the fourth wave of COVID-19 infections, but it's currently recording the second most daily infections just behind KwaZulu-Natal. So for an update on the numbers as well as vaccination rates, the Western Cape Health Department head, Dr. Cloete, joins me now from Cape Town. Dr. Cloete, always a pleasure speaking to you. Let's talk a little bit about how are you faring as a province in being able to, maybe I would say, recoup after the December holidays, as it were, and the movement of people that was subsequent to that?
Yeah, good evening, Faith, and good evening to the viewers. We are very glad to say that we are officially have passed the peak. We've been watching the numbers and the daily infections quite closely. Our highest recorded 7-day moving average was recorded on the 23rd of December. And that was just close on 4,000 cases on a 7-day average. We are down to about 2,200 on the 7-day average now, and there is a daily decline. All our other markers are showing a decline. Hospitalizations have stabilized and coming down. Our deaths are still increasing, but it's very low. And then our oxygen use has never really increased. So all the markers are, including the case positivity rate, that we are on the decline. And we are coming off the wave. Our number to get to out of the fourth wave completely is around 600 average daily cases over 7 days. We think that we will reach that in the next 10 to 14 days. So all markers are good. We don't think that travel will influence that much any cases because Omicron is so widely across the country. Any movement of travelers would have been people either having been exposed to Omicron already, and there's quite high levels of immunity already circulating in the communities.
Yeah. You know, Dr. Keith, these days we seem to not ask as much about healthcare workers that are really on the front line are being able to tackle this pandemic. It's almost as though because everybody within the healthcare sector is assumed to have been vaccinated, that we almost assume that they're just living with the virus. But indeed, healthcare workers are quite central to this in the sense that they have to look after us when we're ill. They have to be the ones that are at the front line, so as it were. And to your assessment, how are healthcare workers doing psychologically, physically during this time?
Faith, this is probably the most important aspect of having to have dealt with 4 waves of COVID, and at the same time doing a massive vaccination program and having to deal with all the other healthcare conditions around. So generally, if I have to speak on behalf of healthcare workers, my senior management team in this province have really gone and visited many healthcare facilities over the last 10 days. The healthcare workers are very appreciative of us visiting them on the front lines, but they are visibly tired, they're exhausted. They are very relieved that the fourth wave did not have significant amount of severe cases, people being ill, requiring oxygen, and high numbers of people dying. So that's a big relief to healthcare workers. But the other side of it is, because we've had such widespread Omicron infections, a lot of healthcare workers became infected. Their vaccination has protected them against severe disease, and therefore you've had also staff shortages over this Christmas and New Year period. So healthcare workers are generally exhausted. The mental toll of 4 waves and also having to deal with themselves getting ill, family members getting ill, and in the second wave, specifically for us, a year ago in the Western Cape, losing a lot of healthcare workers and patients, it's taken its mental toll. So in this province, we have done what we've called an intentional grieving and healing process. We have made available mental health care services to our staff, employee wellness sites, and on-site support, on-site counseling, on-site debriefing. And we are really, really glad to say that our healthcare workers are looking at this period for recovery, and we will all come back, but it's been a hard and arduous journey for healthcare workers.
Yeah, Keith, how are you faring when it comes to vaccinations? I mean, we know that as a country we could certainly do a lot better when it comes to being able to pump up, so as it were, vaccinations. But in terms of the Western Cape, where are the missing links? And how is it that you can just tighten the screws a little bit so that vaccination can actually be at a more progressive rate than what we're experiencing as a whole?
Yeah, so Faith, we've actually noticed that the whole December period, there's been a decline in people presenting themselves to be vaccinated. It's been a general decline. Like we have vaccinated more people in this province per 100,000 than in any other province. So overall, our figures don't look too bad when you look at it, consider comparatively to other areas. But we can always improve. So for instance, our over 60s, which was very important for us in this fourth wave, and we've seen a big protection from the vaccination, and our data has come out that our over 60s, 67% of them are all fully vaccinated. And in some areas of a province, 90% of people over 60 is fully vaccinated. That helped in the fourth wave for protection. The other age groups, it's falling down a little bit as you go down the age groups. And we know there's specific geographic areas where it's been a slower uptake. So we start this new year, even with the introduction of the boosters, there's been a slower uptake than we would have expected. But we expect this week, next week, a renewed effort to start again. So we've done quite a few things. We've taken vaccine taxis out into communities. We've made it very convenient for people. We've taken the registration out to people. So we are committed to start off again this new year. We're resetting our targets for unvaccinated people. We know exactly how many should be vaccinated, but we're also setting targets for booster doses, and we're doing it per geographic area.
Yeah, you speak about the geographic areas as well, that you are experiencing a slower uptake when it comes to vaccination. Which particular areas are these? If I just can roughly say to you, just in terms of districts for the province, we know that Overberg has been by far the highest uptake. Overberg is the area around Hermanus, Swellendam, Grabouw, and those areas. The lowest of the districts has been Central Karoo. So we know in Central Karoo around Beaufort West, that is a specific hotspot area where there's been low uptake. When we come to the metro is quite a diverse area. And in the metro, we've had two specific areas that's been low uptake areas. And that has been Mitchell's Plain on the one hand, and then Khayelitsha on the other hand. So between Central Karoo, Khayelitsha, Mitchell's Plain, those have been the areas where we've put additional effort in to take vaccination closer to people and to counter the anxiety and the hesitancy that people have in those areas. We've launched a program, for instance, called Ask Me, I'm a Doctor, because our research has shown the people that are still anxious and not sure, they trust healthcare workers. And we've really mobilized healthcare workers to try and bridge that gap in those specific areas. Yeah, well, and how are you faring of being able to reach those people? Because, the areas that you're mentioning as well, Dr. Keith, are, one would say and describe them as more disadvantaged areas, right? It's not necessarily within the mainstream upper suburbs or the upper echelons of the Western Cape, or Cape Town for that matter, that allows for these vaccinations to become more, or the vaccines to become more easily accessible to them. So in being able to even implement some of those programs, the monitoring and evaluation of such, how are you guys faring in reaching them? It would be sad, it would be a travesty where the poor who want to get vaccinated do not get access to vaccines simply because of geographical strongholds, as opposed to those that are in the more affluent areas, so as it were.
So if I can just play it out, that this is something that's happened in the whole country. When vaccines became available, let's say at sites, and it depended on people coming forward to be vaccinated, at most, let's call it the people that are by means of transport that can get there. Most instances, people that have medical aid have presented and come forward. Our program, ever since about maybe 2-3 months into our program, from about September, October onward, we had a concerted effort in this province, specifically to target those low-income areas. Our specific strategic focus was that we wanted to address inequity. We wanted to make vaccines available to the people that need it most, that has the least means to be able to get it. So therefore, we started targeting outreaches, pop-up sites, going close to people in that area specifically. And we have actually done quite a lot of inroads in those areas, in that over the last 3 or 4 months, the higher uptake of vaccines has been in uninsured people. That's people not on medical aid. And we've done some serious inroads in those specific areas. Obviously, we can do more, and we've learned a lot about equity. A healthcare system really only functions effectively if you can reach the most vulnerable and the people that need it most. So we've learned a lot. we're going into this new year with this equity focus, making sure that we get everything. We have an outreach program to reach everyone, and we continue to work with local leaders, religious leaders, with opinion leaders in those areas to reach the most hard-to-reach people.
We'll leave it there. Keith Cloete there, Dr. Keith Cloete, Western Cape Health HOD, just giving us the latest details in terms of how the province is faring when it comes to COVID-19.